to control the outbreak of coronavirus. Special panel joining us, Dr. Bharat Gopal is the Director of the National Chess Center. Abid Mukhtar, an Indian student who's stuck in Italy. He wants to come back. He's there. We're also joined by Sudhanshu Kaushik. He's the Executive Director of the North American Association of Indian Students. Warm welcome to all of you. And I'm hoping that all of you are safe. And I hope and pray that all of you will continue to remain safe. Dr. Gopal, let me first begin with you. This observation which is now coming out that if we really have to deal with this virus on a war footing, we need the involvement of private sector healthcare practices. I've seen this in Italy. I've seen this I'm hearing stories in London that a lot of private sector hospitals have also come together. What do you think needs to be done in India, sir, as far as the private sector's participation in this battle against coronavirus is concerned?
Yeah, I think that's a very, very obvious solution, because if you look at whatever majority of healthcare provided in our country is, the majority is by private sector. So I think in day-to-day basis, most of the patients all across India will first go and attend a private clinic. I think that is a very, very usual norm in majority of cases, right? So unless we empower these private practitioners or private hospitals to at least order a test, if not start doing it right away, at least there they are allowed to refer these patients, and then that referral is actually valid as a doctor from a government hospital, because that should be the step one. Because even I still feel that empowering all private laboratories to start testing probably may lead to some hue and cry, because you will have patients with very simple common colds. Because of that paranoia and the fear which is there, they will start lining up because they can pay and actually get it done. So we are not very I as a personal as a doctor, I won't be very comfortable lining up all these patients in front of the lab. So I think the first phase would be that, if, as we just heard the ICMR director say, that we have enough labs now, I think we can start as private practitioners, as a private public mix, probably empower few of the hospitals where they have a sort of a check sheet of which patients can be expanded to those labs and actually a testing done. I think that would be a good way to start, because we all need to be together. It's not a question of private, public sector,
Dr. Gopal,
charitable.
I'm in Uttarakhand.
We all have to be
Dr.
together.
Gopal, I'm in Uttarakhand right now, and we will play a ground report in a short while from now, Dr. Gopal. What is happening, and this is what I'm picking up the more I'm speaking to people around me now, is that even if you end up developing some symptom, the distance that you have to travel to go to a government accredited hospital to be absolutely certain that you've not been hit by this coronavirus is huge. Yes, there is a lot of information outreach which is being taken in, but in the place where I'm in right now, it has multiple private sector hospitals but lesser government backed infrastructure. How quickly do you think, what you're suggesting, how quickly can this be done, where government and private sector players come together, they put their heads together, and we come up with some kind of a reasonable, acceptable solution to both sides?
No, I don't think that is very difficult, because, like you said, it takes some time for the patient to actually go, but it won't take a lot of time if we have designated people who can collect those samples and ship them to the nearest government hospital, right? I hope we never reach a stage. Really, I'm keeping my fingers crossed. We never reach a stage where we require whole paraphernalia of our private hospitals actually doing testing. But that would mean that we have actually reached that real bad peaks, and very, very soon. So I am keeping my fingers crossed that the people understand whatever is being told by the media, by all of us for last few weeks, of social distancing, hygiene and everything, and we are able to actually probably just maneuver ourselves away from the firing line of this virus. Somehow, let's hope so.
Right. Well, I'm certainly with you. I remain in eternal. Dr. Gopal, are these the kind of steps? So look at Maharashtra government. The Maharashtra cabinet has decided to close all government offices for the next 7 days. Look at the advisory which is being sent by the Gurugram administration. We've seen similar advisories being put out in Delhi. Actually, in Delhi it was an order. Is this how we need to proceed now? We basically need to have a complete shutdown. Is that what we're suggesting, Dr. Gopal? And is that the best strategy, best road ahead?
Yeah. See, the phase of pandemic where we are moving into, I think that's the only way we can prevent human to human contact. And I think I'll go one step ahead. I think there are lots more areas apart from malls and and these offices where you have congregation of a lot of people. One of them especially is hospitals. So we are actually advocating a lot of our patients not to rush to hospitals at trivial illnesses. Probably have to have some way of phone line help or something, so that we don't want patients to be, if you have gone to any government hospital or for say private hospitals, you can see how much people are there waiting in the waiting areas of hospitals. So we will need to actually somehow sort out, because these are the times when patient have a lot of flus
That's the
and
sad
patient want
part.
to come to the hospital. So we are in fact, and we have to actually probably counsel our patients that unless you are really in the need to come and visit, it's not for your good that you should go to areas which have lots and lots of people, and hospitals are also one of them. So I think that's the logical steps which we are going to take, and I think I'm very very
All
glad
right.
that finally lots of states are coming into it.
Yeah, as new cases come up in Telangana.